But your family also needs public services you can rely on. Education, policing, transport. And nowhere is that more true than our National Health Service. I mentioned earlier on that I spent a couple of days at a hospital in Watford earlier on this year. And while I was there, I met an amazing man called Colin in his 80s, who sadly died a few weeks later. But I will always remember my conversations with him. You see, he remembered the foundation of the NHS. He remembered what life was like before the National Health Service. And I remember him saying to me, Ed, the problem then was you were on your own having to pay for medical treatment. Friends, we are so proud of our National Health Service. And I know my duty to Colin and to the British people. It is to make sure our NHS is there when we need it. So our sixth national goal is that we create a truly world-class 21st century health and care service, because a hospital is only as good as the services in the community. You see, that's the biggest lesson I learnt in Watford. If people can't get to see their GP, if elderly people can't get the visits they need, then they end up in hospital when it could have been avoided. And that's bad for them, and it's bad for the taxpayer. It costs billions of pounds. And let's face it, friends, those services are creaking. Those services are creaking just now. 1 in 4 people can't get to see their GP within a week. We've had the scandal of home care visits for the elderly restricted to just 15 minutes. In this day and age, the NHS does face huge challenges over the coming years. We will transform our NHS. It's time to care about our NHS. We need doctors, nurses, midwives, care workers who are able to spend proper time with us, not rushed off their feet. So we will set aside resources so that we can have in our NHS 3,000 more midwives, 5,000 more care workers, 8,000 more GPs, and 20,000 more nurses. An NHS with time to care.